Good afternoon. I'm Sarah Atherton, Member of Parliament for Wrexham. I'll welcome to this third and final oral evidence session of the Defence Select Committee subcommittee inquiry looking at the experiences faced by women in the military and female veterans. And firstly, I'd like to thank and pay tribute to the previous Veterans Minister, Johnny Mercer, who was a great support to me and a good support to this subcommittee. And we wish his replacement, Minister Leo Doherty, all the luck in the future. Now, to date, we have received 4,106 serving personnel and veterans have completed our survey and submitted evidence in that survey format. We've received 76 pieces of full written evidence. We've held focus groups with 12 serving personnel, and after today we will have held 3 sessions taking oral evidence from 12 witnesses. And the weight of evidence has been compelling, with a spectrum of concerns being raised. And in a week when veterans' issues have been featured heavily in the news, we are pleased to have with us today representatives from the Ministry of Defence. And our witnesses are Baroness Goldie, Minister of State at the MOD, and thank you, Baroness, for stepping in today. We have Lieutenant General James Swift, Chief of Defence People for the MOD. Hello, James. We have Samantha Defarge, newly appointed Director of Diversity and Inclusion. Welcome. And Air Vice Marshal Maria Byford, Chief of Staff Personnel and Air Secretary, and also one of the most senior-ranking women in the military.
Let me just take that a wee bit further, but I'm surprised it's still taking evidence so many years when you're the ministry's gathering evidence that doesn't know some of the answers to these questions and is clearly finding this slightly challenging. General, maybe if I can ask you then, or maybe back to the Baroness, how do you support women to transition if they leave service after taking, for example, maternity leave, given that the written evidence from the Ministry suggests that they might lose out on resettlement entitlements?
Well, if that is happening, then we need to correct that, because that's not our policy. The policy for people leaving under maternity, there's special provisions for that in order that they can either take their resettlement provision early or delayed.
So you would say that that's not that doesn't happen?
I'm saying that the policy is in place to meet the needs of service women in those circumstances, and if they're not getting access to that, then we need to make sure that they are.
If I may, Baroness, I mean, you say it's moving forward quickly. 0.5% change in a year, when you're at a current target of 11, you're at a current actual figure of 11% in the UK regular forces, and your target is 15%. That is not huge movement, and it would suggest that whatever strategy you're approaching or utilising at the moment is not having the effect. It's going to take, you say you don't have a crystal ball, but at this approach, it's going to take decades to even reach the very low target of just 15%. So I think the question for the MOD is, do you need to be more radical in your approach to not just recruiting, but retaining more women in our armed forces, particularly the Army?
Well, what I would observe is that, of course, the figures I gave you cover a significant period of the pandemic, and that has impacted on activity. It would be surprising if that were not the case. What I think I can say is that because of the leadership that's now being provided from the top, because we have an MOD, a very significant civilian population as well as the armed forces, and what we have is leadership from the top. I'm the minister responsible for trying to drive this forward, but I have got total support from the permanent secretary. I met with him this morning, in fact, and he is very, very keen to continue the leadership offered by his predecessor, Stephen Lovegrove, on diversity and inclusion. I couldn't have asked for greater support from Stephen, and I see I'm going to get marvellous support from David Williams. Nick Carter of CDS has been totally supportive, and I have found that, we are working as a triumvirate, if I can be part of a triumvirate. But anyway, we're working as a trio, And we're absolutely joined together in wanting to give this leadership. And I think that in conjunction with what Sam Deforge is responsible for in the new directorate, we can expect to see progress. But as I say, we're not complacent. We're hoping that as we come out of COVID and it is possible to open up more activity and possible then to return to a more active recruitment programme, that conjoined with what I was talking about what we've identified as areas where we think there is a need to see where we can interest women and assist them to come forward.
Nobody's questioning your commitment. Nobody's questioning the collective support there is to effect change. The question I'm posing is the strategy that you're adopting, and we're not seeing the uptake to meet your target. The target is there at 15%, and it's been there for many, many years.
Heard repeatedly through this whole process is marking your own homework and the desire for service people, women as well as men, to have some independence within this process. So why did you not choose to follow Wigston's recommendation? Why have you chosen something different?
So we have followed his recommendation in terms of creating the authority, and indeed I checked with him back in February whether what we were planning to do at that stage, and now have done with Sam's directorate, was addressing this recommendation, and he concurred that it was in all but one respect.
It's that one respect that would instil faith with service personnel in the complaint system, but you've chosen not to do it. I can't understand why you haven't chosen the independent part of it.
I'm slow to catch up, I'm sorry, Chair. Because that's already in place. It's in place through the Service Complaints Ombudsman. So there's a completely independent channel that people can use if they wish. And indeed, at any stage, they can appeal against the bit of the service complaints process that is administered by the services, and then the Service Complaints Ombudsman will deal with those appeals. So they can either go direct or they can appeal. So it already exists.
Nicola Williams, the previous Service Ombudsman, said the process is only as independent as the person holding that position.
The Ombudsman?
Nicola Williams said that.
So yes, but the person holding which position?
The Ombudsman's position.
Yeah.
So again, it's marking your own homework.
I don't want to put words into Nicola's mouth, but I don't imagine she was saying that she felt she was not independent.
Well, I don't know what she said. That's the sentence, the quote verbatim that she said about her position, her previous position.
Well, I will take that away then and pick that up with the current Ombudsman. To understand whether Mariette Hughes feels that she is independent or not. Because if she's not, then that's a real problem. Because she must be independent for the system to work.
So for instance, the anti-bullying helpline, what has that shown? What has come out of that? Is there how many complaints have been through it?
I can come in if you like at this point.
Yes, Maria.
Yeah, certainly. So since the bullying and harassment and discrimination helpline was set up, there have been 287 calls until March. 77% of those have been around bullying, 10% around harassment, 2% around sexual harassment, 10% around discrimination. But I think it's really key that we have an outlet and an avenue for people to be able to raise their concerns, but also that we've got a network of people that know how to deal with it at a unit level and at a local level. And we've got a fantastic network of diversity and inclusion advisors and practitioners that have been trained through the Defence Leadership Centre at the Defence Academy, which enable us to get local help for people. In addition to building on our policies, so getting the joint service publications right, and there's a refresh and a republication of our relevant policies that's ongoing at the moment, and also a focus on informal complaints resolution to try and resolve a complaint through mediation or informal investigation at the lowest possible level to try and resolve the situation before it becomes more serious. For me, this all links back to the findings of Air Chief Marshal Wigston and his recommendations, which are all about authentic leadership at all levels, about relentless engagement across the chain of command, and about consistent communication, as Sam was just saying. Those are the things I think that collectively will lead to meaningful change for defence.
Can I also then look at women's health? And we've had evidence from servicewomen that some military GPs have less understanding of women's health needs, so much so that they don't pursue particular postings due to lack of suitable GPs. What are you doing about this? And can I bring Sam in, please?
Hi there. Yes, so I think the stepping back a moment, I think one of the really important elements that we are doing as the new D&I Directorate is really sort of amplifying the voices of our women, much in the way this inquiry is as well, and not just hearing our women, but really listening to them. And as just mentioned just now, the sanitary products point was a case in point where actually what our women were asking for was different from what we might have otherwise assumed. I think when we are looking at the provision of support from GPs and the medical services, I've actually got a meeting coming up in the not too distant future with our Surgeon General to explore some of these sorts of issues. I think we also have to recognise the sort of the primary care and occupational health piece that is part of the defence provision, and the secondary care and specialist care where NHS would be involved. But I think, I did some work in my role as previous gender champion around the menopause specifically, and it came up that the menopause was one particular area where some of our armed forces women didn't feel that they necessarily had the level of support and understanding from their GP services within defence. And it's an area that we are working on in terms of, well, how do we raise understanding? How do we ensure the training's in place? How do we ensure that they have confidence in the services that can be provided? So I would say that's a point, again, that's very much front and centre for us, and one that we're focusing on.
Just pick out something about retention. 31%, nearly a third who completed our survey, said they left the military because of poor work-life balance and family commitments. So how are you going to measure your success? Because you're obviously implementing a lot of strategies, a lot of programs, all looks and sounds great. But how are you measuring success? Have you got strategies in place to say that your initiative is changing what's happening on the ground?
You'd like me to take that one?
Annabelle.
Well, thank you, Chairman. I mean, going back to the point that Mr Elwood was making, and he's to be commended for the initiative he took when he was Minister, because I think that was singularly important in opening up a whole new opportunity for women in relation to the armed forces. On this question of recruitment, the only information we have statistically is that over the last 5 years, armed forces, over the last 5 years, female armed forces personnel have had lower voluntary outflow rates than male personnel, and that, to an extent, is encouraging. I mean, all we can do, and I defer to James Swift in this, but I mean, we do collect data via the Armed Forces Continuous Attitude Survey. That's pretty well our indicator, if you like, as to the direction of travel and what is happening. What I'd like to think, Madam Chair, is that with the combination of activity now taking place, which has been described by all the witnesses in different ways, I think there is an aggregate effect, and I think that aggregate effect is positive and beneficial. But you're absolutely right. If we're looking for empirical evidence as to whether the policies in implement are delivering, we have, I think, to go back to the evidence and data provided by these surveys. I think that's the only way to get a firm handle on that. But I defer to James Swift, who may have something to add in respect to that.
Just to sum up, 76% of veterans who completed our survey said the MOD were unhelpful with them transitioning into civilian life. So I'm really pleased to hear about the Career Transition Partnership and the Defence Transition Service. So Annabelle, James, Maria and Sam, thank you very much for appearing today. Again, I'd like to thank the Secretary of State for Defence, Ben Wallace, for permitting us to speak to serving personnel. It's certainly given our inquiry's substance, and 9% of serving women have contributed to this inquiry. The problems faced by women have evolved over decades, not on one person's watch. But despite this, 9 out of 10 women recommend a career in the military. But when things do go wrong, it looks as if they go wrong dramatically, and that has enduring effects on the rest of these women's lives. But there are some easy fixes, and I'm pleased that the MOD, particularly in the last 10 years, particularly 5 years, have been starting to address some of these issues and acknowledging at least there are problems, which is absolutely the first step. Now, our report will be published in June, and we look forward to the MOD's response with a sincere hope that the MOD will embrace our recommendations, which will ultimately make the British Army an even better place for a woman to serve, and for Britain to be the best place to be a veteran. So lastly, most importantly, I'd like to thank all the serving women and men, veterans, civil servants, representatives and charities that have contributed to this inquiry. And a special thanks to the Defence Select team, which I'm looking at now. Thank you very much, team, and the administrative team. It's been quite an intense year. Order, order.